Hello, dear nursing aspirants. Welcome you all to the Master Nursing classes. So, in the last previous class, we have discussed the very important and hot topic questions on the pharmacology. And in today's session, also, I am discussing the very much important questions on the pharmacology, where in one single particular question, I am discussing 7 to 8 questions that is much necessary for you to remember, study, and know before going to the main exams. In part 1, part 2, and part 3 of the pharmacology, also, I have covered the very much high yield content, topic, and questions. So, that is very much necessary to know before going to the main exams. Okay. So, lot of thing is there to study in the pharmacology. I am choosing the thing which is repeatedly striking in the exams and manifesting in front of you all. So, that helps you to boost your rank. Okay. So, it is very important to know the pharmacology and practice the pharmacology for the exams because it is also having the important role to decide your ranks. Okay, so I'm not telling you people to study entire pharmacology. I am telling to study the important thing from the pharmacology. Okay, so here also I am trying to give you important content from the pharmacology. So do watch the video completely till the end. If anyone is new to the this MNC Master Nursing Classes family, so do subscribe to the channel because this channel is the channel which is giving the very high yield content without wasting the any time of the aspirants. Okay, so if you are new and you are watching first time, hit the subscribe button. So it will help you to give a it will help you to boost your aspirants journey, and it will keeps on giving the high authentic content. So that is much necessary for the aspirants. Okay, so bacho, in the last 2 3 videos we have discussed the important things. After watching this video, you people have to go and watch those videos also. I will give the link of those videos in the at the end of this class. Okay, and you people can directly watch from the play store also. ಓಕೆ ಸೊ ಯಾರೆಲ್ಲ ಕೆಇಎ ಎಕ್ಸಾಮ್ಸ್ಗೂ ಕೂಡ ಪ್ರಿಪರೇಷನ್ ಮಾಡ್ತಿದ್ದೀರಾ ಅವ್ರಿಗೂ ಕೂಡ ಈ ಕ್ಲಾಸಸ್ಗಳು ತುಂಬಾನೇ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿರುತ್ತೆ. ಓಕೆ, ಸೊ ಕೆಇಎ ಎಕ್ಸಾಮ್ ಅಂತ ಸಪರೇಟ್ ಫಾರ್ಮಕಾಲಜಿ ಸಿಲೆಬಸ್ ಇಲ್ಲ. ಅಲ್ಲೂ ನಿಮಗೆ ಫಾರ್ಮಕಾಲಜಿಯಿಂದ ಲೈಕ್ ಆಂಟಿಸೈಕೋಟಿಕ್ಸ್, ಆಂಟಿ ಡಿಪ್ರೆಸೆಂಟ್ಸ್ ಇದರಿಂದ ಸಿಕ್ಕಾಪಟ್ಟೆ ಕ್ವಶನ್ಸ್ ಕೇಳಿದಾನೆ. ಅದು ಕೂಡ ನಿಮ್ ಕೆಇಎ ಎಕ್ಸಾಮ್ ಅಲ್ಲಿ ರ್ಯಾಂಕ್ ಡಿಸೈಡಿಂಗ್ ಆಗ್ಬಹುದು. ಸೊ ನೀವು ಕೆಇಎ ಎಕ್ಸಾಮ್ಸ್ ಕೂಡ ಪ್ರಿಪೇರ್ ಆಗ್ತಿದ್ರೆ ನೀವು ಕೂಡ ಈ ವಿಡಿಯೋದು ನೋಟ್ಸ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಯಾಕಂದ್ರೆ ಈ ವಿಡಿಯೋ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಓನ್ಲಿ ಶಾರ್ಟ್ ಡ್ಯೂರೇಷನ್ ಇರುತ್ತೆ, ಅದಾದ್ಮೇಲೆ ನಾವು ತೆಗ್ದಾಕ್ಬಿಡ್ತೀವಿ. ಓಕೆ, ಸೊ ಎಸ್, ವಿ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ದ ಟುಡೇ ಸೆಷನ್ ವಿತೌಟ್ ವೇಸ್ಟಿಂಗ್ ದ ಟೈಮ್. ಸೊ ಹಿಯರ್ ಇಸ್ ದ beautiful question in front of you all. Okay, and very important question. I will cover all the antipsychotic drugs, anti-epileptic drugs in one this question. Okay, so the question is very simple. Which of the following is the yes? Which of the following is the anti-epileptic drug considered as safest during the pregnancy? Okay, the question is very simple. Which anti-epileptic drug is considered as the safest drug during the pregnancy? So option A, it is telling the sodium valproate. Bacho, it is contraindicated during the pregnancy. Why it is contraindicated during the pregnancy? Means it causes the neural tube defect in the babies. So that is the reason the sodium valproate is contraindicated during the pregnancy. I am eliminating the option. Okay, so then option B is the phenobarbital. Option B is the phenobarbital. So this is considered as a second best drug. Okay, second best drug during the pregnancy. Okay, so then option F is the lorazepam. This is the drug of choice to treat status epilepticus. What is status epilepticus? What is the status epilepticus? If epilepsy or the seizure which is coming continuously, okay, without going to the normal level of the consciousness, and there is more than 2 episodes in 5 minutes, we can say the criteria, and the seizure onset occurring before going to the normal level of the consciousness or without going to the normal situation. The second seizure onset happened and again the third one happened. So repeatedly seizure episodes are happening, means that is what you call the status epilepticus. So the drug of choice for the status epilepticus is the lorazepam. Okay, so the route of lorazepam administration in the status epilepticus is the intravenous Lorazepam, that is the IV lorazepam is the drug of choice for the status epilepticus. Then comes to the option E, that is the ethosuximide. This is the drug of choice for absence seizure. The most common seizure in the children is the option seizure. So in the option seizure, the drug of choice is the ethosuximide. Very, very important for you all. Okay. So how the questions will comes? Yes, on the option seizure. Yes, this seizure is also called as the daydreaming seizure. Okay. Here the child suddenly will show the like daydreaming appearance and there is a spell of the blank. Okay. So he will like the child is playing football, you consider he is running and suddenly he will stop for a 3 to 4 second like blankly he will stand, but there is intact of the muscular tone. Okay, there is no any decrease in the muscular tone, means there is less chance of the fall down risk in the option seizure. But suddenly the child will show the, yes, the staring spell. Here means suddenly the child will remains blank for a few seconds and again he will run. Okay, so that is the option seizure we can say. Okay, the daydreaming seizure, the sorry, and the very importantly the staring spell seizure, that is the option seizure. In the option seizure, the drug of choice is the ethosuximide, right? So this is also not our answer. Then comes to the carbamazepam. This is the drug of choice for the partial seizure. This is the drug of choice for the partial seizure. Very, very importantly, note it down. And the carbamazepine is the drug of choice for the trigeminal neuralgia also. Okay, the drug of choice for the trigeminal neuralgia. What is trigeminal neuralgia? Yes, trigeminal neuralgia is the nerve pain. Neura means nerve, algia means pain. So it is the nerve pain of the trigeminal nerve. Okay, so because of this, some legends, some compressions over the trigeminal nerve, there is excessive facial pains because the trigeminal nerve is having the three branches. Okay, so yes, one is the mandibular, maxillary, and one more is, yes, ophthalmic branch. So there are three branches. Among these three branches, yes, two are motor, one are sensory. Okay, so there is excessively stimulation will be there in the all part of the face. Okay, that may leads to the excessive pain in the face. That is what we call the pain due to the neuralgia, pain due to the trigeminal nerve irritation. That is the trigeminal neuralgia. In the trigeminal neuralgia, also drug of choice is the carbamazepine. Okay, very, very importantly. Then comes to the lamotrigine. That is your correct answer for this question. The lamotrigine is the drug of choice or the safest drug during the pregnancy. Okay, so this is your first answer. The safest drug or the first drug of choice during the pregnancy in seizure case or epilepsy case. The first drug and best drug in the pregnancy and the safest drug is the pregnancy is the lamotrigine. If this lamotrigine is not there in the option, you people can go for the phenobarbital. The question is very simple: which of the following anti-epileptic drug is considered as the safest drug during the pregnancy? So your lamotrigine is the safest drug during the pregnancy. If this one is not there in the option, you people can choose the phenobarbital also as an answer. Okay, yes, and many other questions I have discussed here. The drug of choice for the status epilepticus is the IV lorazepam. Drug of choice for the absence seizure, yes, for the absence seizure, the drug of choice is the ethosuximide. Then the drug of choice for the trigeminal neuralgia, carbamazepine. The drug of choice for the partial seizure is the carbamazepine. And the second best drug for the in pregnancy is the phenobarbital. And very, very importantly, drug of choice for the all seizure like generalized tonic clonic seizure, clonic seizure, tonic seizure, myoclonic seizure. Okay, so that is grand mal seizure and everything. The drug of choice is the sodium valproate. Okay, only in the partial seizure, only in the partial seizure, the drug of choice is the carbamazepine, and only in the absence seizure, the drug of choice is the ethosuximide. In the status epilepticus, drug of choice is the lorazepam. In pregnancy, lamotrigine is the first drug, and second one is the phenobarbital. Hope the concept is clear. And one more important question, that is on the febrile seizure. Because of this sudden increase in the temperature, because of this sudden increase in the temperature in the children's, mainly seizures can occur because of the increased body temperature. That is called as the febrile seizure. Okay, that is what we call as the febrile seizure. So here the treatment is the, yes, that is the rectal diazepam plus intravenous paracetamol is the drugs where we are giving in the treatment of the febrile seizure. And one more new treatment also there is introduced, that is the intranasal midazolam. Okay, this is also important thing all the people have to remember. Okay, intranasal midazolam, or else the universally used treatment is the rectal diazepam plus IV paracetamol. Okay, this paracetamol which decreases the temperature, and diazepam which treats the and keeps the brain cool and calm, and it will not allow to enter the abnormal electrical activities in the brain. So this is how this both coordinately works and controls the febrile seizure. And the intranasal midazolam also new treatment, okay, which we can use in the treatment of the febrile seizure. Hope the concept is clear on the seizure topic. Okay, on the pharmacology, here is the next and very important for your upcoming exams, this one. Yes, the question is very simple and repeatedly asked in the exam. So what is the, yes, typical therapeutic plasma concentration range for the lithium in the treatment of the bipolar disorder? Okay, in the treatment of the bipolar disorder, so what is the plasma concentration of the lithium? Consider bachon, lithium is a very important drug for the exam. So this is the drug of choice for the mania, treatment of the mania, treatment of the bipolar affective disorder. Okay, and many situation this one is the drug of choice, and mostly the examiner will ask the questions lithium and mania and lithium and bipolar disorder. But in the, yes, acute mania, in acute mania means the patient is hyperactive. Okay, very hyperactive. This situation, this lithium won't works, because after administration of the lithium require 1 to 2 weeks to show its therapeutic effect. Okay, so how much time the lithium will take to show its therapeutic effect? It takes 1 to 2 weeks to show its therapeutic effect. Here is the acute condition, means there is sudden increase in the mood of the patients. That situation we are giving the lithium means the lithium will work after 1 to 2 weeks of the administration. So that is the reason in the acute mania, yes, we can't give the lithium. So there is the first choice is the atypical antipsychotics. Atypical antipsychotics we can use. So this one not there in the options. The second answer will be the haloperidol. Okay, so haloperidol we can use in the treatment of the acute mania, and first choice would be the your atypical antipsychotic, and second choice would be the your haloperidol. Very importantly consider. But the examiner asking just the drug of choice for mania is the lithium, and the treatment where we are using in the acute mania is the, yes, atypical antipsychotic. If that one is not there in option, go for the haloperidol is the correct answer. Okay, so but the question is very simple, that is the what is the therapeutic plasma concentration? Okay, so yes, what is your answer here? Option A is telling that it is 0.6 to 0.12 milliequivalent per liter, and option B is telling that it is 0.8 to 0.15 milliequivalent per liter. Then option C is telling that it is 1.5 to 2.5 milliequivalent per liter. Then option D is telling that it is, yes, option D is telling that 2.5 to 4 milliequivalent per liter. So the first one, that is 0.6 to 1.2 milliequivalent per liter would be your answer when if the examiner asking what is the normal concentration for the prophylactic dose. Okay, so this is the normal plasma concentration for the prophylactic dose, that is the 0.6 to 1.2 milliequivalent per liter. Okay, so the examiner asked the therapeutic plasma concentration. Okay, so this one is the prophylactic plasma concentration, and therapeutic plasma concentration is the correct answer. That is the option, yes, B is the correct answer. That is the 0. Okay, that is the 0.8 to 1.5 milliequivalent per liter. This one is the therapeutic plasma concentration. Okay, so this one goes to the correct answer. And if the lithium level in the plasma which is going more than 1.5 milliequivalent per liter means This is the toxic level. Okay, this one is the toxic level. बच्चों remember the toxic level. Let me take a new board here and explain you nicely the toxic level. Okay, so what I told, that is the 0.6 to 1.2 milliequivalent per liter. This one is the prophylactic dose. This one is the prophylactic dose. Okay, then 0.8 to 1.5 milliequivalent per liter. This one is the therapeutic, not dose. This is the prophylactic concentration, and this one is the therapeutic plasma concentration. Okay, if it is going more than 1.5 till 2 milliequivalent per liter, it is indicating the mild toxicity. It indicating the mild toxicity. Then 2 to 2.5 milliequivalent per liter. This one is the moderate toxicity. And if it is more than 2.5 milliequivalent, that one is the severe toxicity. So this range may strike in your exams. Okay, remember now, revise now, and give the best shot. This one is from the most authentic book. Okay, in many books you people will say, you people will see some alteration in the values, like in some book it is given 0.5 to 1. Okay, this is from the very authentic book I am where I personally use for my preference. So that is the 0.6 is to 1.2 is the prophylactic range, and 0.8 to 1.5 is the therapeutic plasma concentration, which is going more than 1.5 till the 2 is the mild toxicity of the lithium. And if the plasma concentration 2 to 2.5, that is the moderate toxicity of the lithium. And if plasma concentration is more than 2.5, this is the severe toxicity of the lithium. Very very importantly, you people have to consider. And the question was, that is the plasma therapeutic concentration. So our answer would be option B goes to the correct answer. Yes, I have already told this one. Okay. So very, very important for you all. And read, revise, and give the best shot in the exam. Okay. So here's the important announcement for you all who all are giving the upcoming CRE exam. So for all of you, we have announced the same pattern exam for the upcoming CRE exams. Okay. So it is live in our app. So all people have to download the Master Nursing Classes app from the Google Play Store. Okay. So here we have given the 100 questions. In that one, 75 is the non-nursing, 75 is the nursing, and 25 is the non-nursing, with 5 sections we have made. Okay, each section containing the 20 questions for the 18 minutes for your better performance. So we have introduced there, and the exam is live in the morning 6 a.m. and it will be live till the 11 p.m. So from the 6 a.m. to 11 p.m. anytime you people can give the exams after the 11 p.m. within 12 a.m. midnight, within 1 hour, our engineering team, they will analyze the result. Okay, and they will send the results to our WhatsApp group, Telegram group. Okay, everything, everywhere, wherever our social media platform is there. So there, everywhere they will share our ranks. Okay, so if you are applied for the CRE exams, so once you experience the real exam pattern, that is helpful for you. Okay, so for any concerns and any kind of the information, this is our relationship manager number, that is the 8296 554687. So you can contact to this number. So sir will explain the thing what is necessary for you all, and based on your which exam you are preparing, he will guide accordingly. Okay, so yes, so this is the important notification for you all. Yes, here is the next one more thing, the question, and very very important question, very important questions. Which of the following is used in the severe cases of the lithium toxicity? Which one is the severe cases? Yes, where the lithium level gone behind 2.5 milliequivalent per liter. This one is the severe lithium toxicity. Just now only we have discussed here. That is a severe lithium toxicity. If it is gone more than 2.5, the ranges may ask in the exams. Okay, remember, particularly when the level exceeds more than 2.5 milliequivalent per liter, So which of the following is used in case as a treatment? Option A, that is the sodium polyethanol sulfonate. If the examiner is asking the question, it is mild to moderate, and yes, it is mild to moderate, and the patient came within 4 hours of the lithium toxicity. So this would be our antidote. Okay. Remember, bacho, for the lithium toxicity, antidote is the sodium polyethanol sulfonate. Okay, if the patient comes within 4 hours, so we can give the antidote very, very importantly. But this is not a best treatment in the severe case. Okay, so then I am moving for the next option, that is the stop lithium and start IV fluid. This is the priority. Priority in the lithium toxicity is the, yes, if the patient found any toxic to the lithium, so where we have to stop the lithium and start the IV fluid. This is the priority intervention. Okay, so I will tell why we have to stop the lithium and why we have to start the IV fluid immediately. And option B goes, that is the hemodialysis. Okay, so this is the best treatment and best management of the lithium toxicity is the best and perfect management for the lithium toxicity is the hemodialysis if it is severe. Okay, so hope the concept is clear on this one. That is the hemodialysis is the, it's a process of purification of the blood and removing the all waste from the blood by using the hemodialysis machine. That is what we call as the hemodialysis. Okay, so very, very importantly, and the first priority what I told, that is the stop lithium and start IV fluid. So why I have told like this? Okay, let me explain with rationally, because this is will be also asked in your upcoming exams. Bacho, so when you will take the lithium, if it went to the toxic level means, okay, so when it will went to the toxic level means that situations it induces the nausea and vomiting. So because of the nausea and vomiting, there will be a fluid loss. There will be a fluid loss. In order to replace this fluid, we have to start the IV fluid. Okay, one thing is clear here, and patient is already in the toxic level of the lithium. So that is the reason why we have to stop the lithium immediately. So the priority treatment would be in the lithium toxicity. That is the stop the lithium. Okay, so stop the lithium and start the IV fluid. And one more thing, whenever there is nausea and vomiting, there is sodium level will be decreases in our blood. So the sodium level it get decreases in the blood means increases the risk of lithium toxicity. Increases the risk of the lithium toxicity. So which element or which, what we can say, electrolyte is very, very important in the patient who is taking the lithium is the, that is the sodium. So how the sodium decrease increases the risk of the lithium toxicity? Let me explain, because this is also most important and repeatedly asked question. Okay, so consider the sodium is get decreases means our kidney it will start to reabsorb the sodium. It will start to reabsorbs the sodium. The sodium is reabsorbing means along with the sodium, water also it will get reabsorbed. So water and sodium both are reabsorbed means the lithium also it will get reabsorbed. Okay, so here this is the style or this is the route how in the hyponatremia lithium toxicity increases. Decreased sodium means kidney start to reabsorb the sodium. Along with the sodium, water will reabsorb. Along with the water and sodium, lithium also reabsorbs. Okay, and lithium reabsorbing means lithium return coming to the blood and it will not excreting. Okay, it will not excreting and it is return coming to the blood. So again, the blood lithium level, if it is increasing more than 1.5 milliequivalent per liter, means it will again goes to the toxic level, right? So this is the concept. So remember, bacho, sodium is most important electrolyte where we have to assess during the lithium therapy. And as a nursing officer, you have to advise to the patient and educate to the patient that the patient who is taking the lithium, if he experienced any diarrhea, any kind of the vomiting, any kind of the fluid loss, Okay, he should immediately report to the hospital because the diarrhea reduces the sodium, the vomiting reduces the sodium. So decrease in the sodium level increases the lithium toxicity. If the patient is experiencing any kind of the fluid losses, so immediately he should come to the hospital. So this one we have to educate to the patient. And the scenario based question may also comes like this. The patient is 38-year-old and he is taking the lithium since from the uh, last 8 months, and suddenly the patient is experiencing the nausea and vomiting and diarrhea because of the food poisoning. So what it will and how it will makes the patient to get more prone to the lithium toxicity means it will reduces the sodium and increases the risk of the sodium. And one more situations they can do the same as the yes, which of the following patient is having the highest risk of the lithium toxicity. Okay, so here again the patient they will give yes, uh, diuretics, then nausea vomiting patient, and the patient who is on the yes, long term enema therapy. Okay, yes, option D will be the all the above. What is the correct answer? All the above is the correct answer. Why? Because in the diuresis also there is loss of the urine. Along with the urine, the sodium will get lost. Okay, again it will start to reabsorb after some time. So don't give the lithium and diuresis together. And yes, in the patient with nausea, vomiting, fluid loss, sodium loss, again reabsorption of the sodium, water, and lithium again increases the toxicity. And the patient who is on the enema therapy for the long term, so again there is loss of the fluid and electrolyte. Again, the patient will increase the risk of the lithium toxicity. The answer is the correct one is the all the above. So this kind of the situations examiner will make in front of you all. So all you have to think in the all direction. Simply cool, calm, relaxed, and apply the rationally and the thing what you have read, okay, what you have heard by the master nursing classes. So just try to apply on the question and try to eliminate the question which is not related to the question. So it will definitely guide you to the correct answer. And this is the way how we how to control the negative marks also, bachcho. Okay, so is that clear? Yes. So here is the one more beautiful and important question. Yes, in this question I am trying to cover you some more important questions on this particular topic. Okay, so yes, the question is very simple. What is the drug of choice for the treatment of the pneumocystic zero wiki pneumonia in HIV infected patient? Bachcho, patient is infected with HIV means the immunity of the patient will get decreases. Why? Why? Because there is very important cell which is called as the CD4 cell. It will get decreases in the HIV patient. Okay, so the normally CD4 is to CD8 ratio. It will be the yes 2:1. It is normally, but in HIV patient, CD4 count it will decreases. Okay, and it will very much decreases. The count becomes yes, that is the 1:2 here. Okay, the CD4 is to CD8 ratio in the HIV is the that is sorry, in HIV CD4 is to CD8 ratio will be the 1:2 because the CD4 count decreases very rapidly here in the HIV infected patient, and the CD4 count decreasing means the immunity also decreasing. Wherever there is decreased immunity, there is highest risk of these infections with fungus, that is the pneumocystic jirovecii. Okay, so the most common cause of the pneumonia in HIV patient is the pneumocystic jirovecii. The most common cause of death in HIV patient is the pneumonia, and the cause for that one is the pneumocystic jirovecii. And in some book and in some authors, they will call this pneumocystic jirovecii as a yes pneumocystic carinae also. Okay, so pneumocystic carinae and pneumocystic jirovecii both are the same. Okay, don't confuse between those things. Okay, so very importantly, I have told the CD4 is to CD8 ratio. Normally it is 2:1 in HIV patient. In HIV patient, it is 1:2, and the most common cause of the pneumonia in HIV patient is the pneumocystic jirovecii. And which drug we have to give to treat the pneumocystic jirovecii as a drug of choice? That is the quatrimoxazole is the drug of choice where we are using in the treatment of the pneumocystic jirovecii in HIV infected patient. these questions may strikes in your exams directly. Okay, so these questions may strikes in your exam directly. It is important, right? So here is the next question for you all. That is again the very simple question and very important and repeatedly asked question. Okay, so that is the frequently asked question. Okay, so what is the drug of choice for the prevention of the vertical transmission of HIV from mother to the child during the labor birth? Okay, so what is the vertical transmission? Yes, what is the vertical transmission? Consider this is the beautiful mother abdomen. Okay, so here is the uterus, and inside the uterus here is the placenta, and here is the baby. Okay, so here the blood of the mother is having the infected any viruses or bacteria. If it is crossing the placenta and if it is infecting the baby, that is what we call as the vertical transmission. Okay, so that is what we call as the vertical transmission, or we can say the transplacental transmission also. Okay, so if the mother is infected with HIV, and it may there is chance of the getting infection to the baby. So when is the maximum chance? When is the maximum chance? Means during the birth, or we can say during the delivery. Why? Because the baby may directly exposed to the mother blood here. Okay, in the some vaginal secretions, in the some vaginal bloods, the baby may directly exposed to the mother blood. So the maximum transmission will happens during the birth or during the delivery. So that's that one we can say the perinatal. Okay, what is the perinatal? Perinatal transmission is the maximum transmission. Okay, so prenatal is the before the birth. Perinatal is the during the birth, and postnatal is the after the birth. Okay, so natal natal means here is the birth. Okay, prenatal is the before birth or during the pregnancy. Yes, that is the perinatal is the during the delivery, and postnatal is the after the delivery. Okay, so these are the common and simple words all you people have to remember. Okay, so when will be the more chance of the transmission of the HIV? During the perinatal period, or during the birth, or during the delivery. Okay, this is the question, it may strikes in your exam. So which one is the drug of choice where we are using into prevent the vertical transmission or the perinatal transmission from the mother to the child? Okay, so that is the correct answer goes to here is the yes, all of you, almost all of you have given the correct answer. That is the nevirapine is the drug of choice and the single best drug to prevent the perinatal transmission. Okay, that is the nevirapine. So if this one is not there in the option, this is the first answer. Okay, consider the examiner is not given this option. The second best option is the judovidin. Okay, second best answer is the judovidin, and the first best answer is the nevirapine. Okay, note it down in your last minute revision notebook and revise just before going to the exams. But each and every questions I am trying to solve the many concept that is most important for your exams. Okay, so here is the one more important question that is on the allopurinol. Okay, so yes, the question is simple and the concept also simple behind this one. Yes, that is the allopurinol is primarily used in the treatment of the which condition? That is the option A gout, option B hypertension, option C diabetes, and option D asthma. So in which condition we are using the allopurinol as a drug of choice to treat? Yes, almost all of you have given the correct answer. That is the gouty arthritis. The drug of choice is the allopurinol. Okay, bachcho, remember the allopurinol is the xanthine oxidase inhibitor. What it will do? It is inhibiting the xanthine oxidase, as the word itself it says. What is the xanthine oxidase and what its use? Already I have discussed in the last question. Yes, the xanthine oxidase is the enzyme which converts the purine, to uric acid. Okay, so conversion of the purine to uric acid. Which enzyme is responsible? Yes, that's the xanthine oxidase is the enzyme which is responsible. So where this uric acid, it will get accumulates accumulates in the small joints, especially in the great toe, okay, and which causes the gouty arthritis. This is how the gout will happens. So I am giving a drug here which inhibiting the xanthine oxidase, means there is no conversion from the purine to the uric acid, means there is no uric acid, means no accumulation of the uric acid in the joints and great toe, means there is no gout. Okay, so for the treatment of the chronic gout, okay, so remember the two questions again will arise here, so that is very importantly. Okay, so that is the on the gout is the, yes, accumulation of the uric acid in the small joints, that is what we call as the gout. Okay, so there are two type of the gout, that is acute gout, and one more is the chronic gout. Okay, so in the acute gout, the drug of choice is the, that is the indomethacin. Okay, so this is the drug of choice, and drug of choice for the chronic gout is the, that is our allopurinol. Okay, important thing, all you people have to remember and give the best shot in the exam. Okay, so because I have discussed this one in detail for you all. Okay, is that clear, bacha? Yes, is that clear? Yes, here is the next question for you all. And answer for this one is the gouty arthritis, where we are using the allopurinol to treat the, yes, gouty arthritis. And this is the xanthine oxidase inhibitor, which prevents the conversion of the uric acid to, purine to the uric acid. Okay. One more important point, remember. So, in the patient who is there is risk of the gout, where we have to avoid the drugs which are having the rich in the purine. Okay, so purine rich drugs the purine rich food we have to avoid. So what are the purine rich food? That is the aged cheese, okay, coffee, beer, and some organ meat, that is the red meat, organ meat, cheese, beer, coffee, these all are highest, which all are having the highest purine. So this purine protein rich drugs food we have to avoid here, which is very important. Okay, the examiner will ask the question on that part also. Okay, so here is the next and important thing, that is which of the following is not an atypical antipsychotic. Yes, so which of the following is not a atypical antipsychotic? There is fixed one question from the antipsychotic drugs. Okay, so among those, so there are questions from the side effect, there is questions from the extrapyramidal symptoms, and the questions from the classification also it will ask in your exams. So we will discuss extrapyramidal symptoms separately. I will, don't worry, I will discuss that part also. Okay, so which of the following is the not a atypical antipsychotic, the examiner is asking. Students, we are having the antipsychotics in two generation. One is first generation, another one is the second generation. For the first generation, we can say that is the typical antipsychotic, and second generation we can say this one is the atypical antipsychotics. Okay, so these typical antipsychotics directly acts by blocking the D2 receptor, and these atypical antipsychotics which acts by blocking the 5-HT or serotonin. Okay, so these are the serotonin blockers mainly, and these are the D2 receptor blockers, means dopamine 2 receptor blockers. Okay, so very importantly, it will block the serotonin also, mainly it blocks the dopamine, and it will block the dopamine also, and mainly it blocks the serotonin. Clear? So this is the difference between the typical and atypical antipsychotics. Okay, to remember that one, I have already previously told in one class, that is the how to remember the atypical antipsychotics, that is by remembering this mnemonic, that is the cockroach. Okay, so Q here is the quetipine, A here is the aripiprazole, C here is the clozapine, R here is the risperidone, O here is the olanzapine, and Z here is the ziprasidine. Okay, so these all are the atypical antipsychotics. Okay, so apply this mnemonic in this question. It will come or not? Let us check. Yes, the O here in the cockroach is the olanzapine. Yes, That is the atypical antipsychotic, but the examiner asked not a atypical antipsychotic. This is the typical antipsychotic, means it is not our answer. Then C is the clozapine. So I have written the clozapine here. Yes, I have written. This is also atypical antipsychotic. Yes, I am eliminating the option B also because this is also atypical antipsychotic. Then comes to the Q. Here is the first drug quetiapine. This is also atypical antipsychotic. So I am eliminating the option D, that is the quetiapine or typical antipsychotics. Okay, so you people can remember this one as the haloperidol, which is a typical antipsychotic, and the typical antipsychotic which is having the maximum effect of causing the extrapyramidal symptom. So that is the haloperidol. Okay, so haloperidol is the drug which having the maximum efficacy to cause the extrapyramidal symptoms. Okay, so hope the concept is clear on this question, and remember this mnemonic. So this mnemonic for the remembering the typical antipsychotics. Okay, antipsychotics. So remember this one, apply this one in the exams, and if the examiner is asking the opposite question also, like which of the following is an atypical antipsychotics, okay, he will give the three example for the typical and one he will give the atypical. So both question you can solve if you are remembering one only. Okay, so in the typical mainly we are having the haloperidol and other drugs. So that is like chlorpromazine. The first antipsychotic drug is the chlorpromazine, which is the first antipsychotic drug. That is the chlorpromazine. Okay, so in clinical setting we call that one as the CPM. Okay, so PCM is alag bacho. PCM is the paracetamol. Okay, CPM is the chlorpromazine. This is the first antipsychotic drug. Okay, so which one is the first antibiotic? Yes, which one is the first antibiotic? Yes, that is the. Can anyone wants to tell the answer in the comment box? Which one is the first antibiotic and who discovered that one? Already I have told in the long back questions. So if you know that one, just comment in the comment box. Okay. Yes, the first antibiotic. I will tell who discovered that one. Yes, the Alexander Fleming. He discovered that one. Okay. So the first antibiotic is the. It will start with the name of the P. Okay, so write in the comment box. Okay, I have given the clue. Okay, the drug name which starts with the P and which is the first antibiotic which is discovered by the Alexander Fleming. Okay, so which antibiotic, that one you people have to comment in the comment box. Okay, yes. Here is the one more beautiful and important question for our upcoming exams. So that is the which of the following should be monitored regularly when the patient is on the clozapine therapy. Just now only we have seen the clozapine. It is a atypical antipsychotic. Okay, and it is a dangerous atypical antipsychotic because these clozapine reduces our leukocytes. Okay, it decreases our leukocytes, means our WBCs get decreases, means the WBCs get decreasing, the white blood cells are decreasing, means there is highest risk of the infection. Okay, so there is increased risk of infection, right? So the drug here we are giving to treat the psychotic symptoms which is increasing the risk of infections, means which is very much dangerous. Okay, so hope the concept is clear. Okay, which of the following should be monitored regularly when the clozapine therapy? So that when regularly we have to monitor for the white blood cells because which decreases the, yes, our WBC cells. Okay, if the WBC is decreased, okay, so in order to increase that one, we are giving the drug that is the filgrastim. I have explained in the first video, first question, that is the on the filgrastim. Most important questions. Three things I have told where we have to give the filgrastim. One with the clozapine therapy, one with the carbamazepine therapy, and one with the, yes, chemotherapy. Okay, so in clozapine therapy also WBC will get decreases. In order to increase the WBC, give the filgrastim. In the carbamazepine therapy also WBC will get decreases. In order to increase the WBC, give the filgrastim. And in the chemotherapy also WBC will get decreases. In order to increase the WBC, give the filgrastim. So This is we have discussed in the in the first video, first question on the filgrastim. I have explained in detail everything on the filgrastim and what to monitor after administering the filgrastim and what is the route of administering the filgrastim also. Okay, so that is the subcutaneously we have to give the filgrastim. Most important, all people have to understand. Okay, so two side effect I want to mention here on the clozapine. It is having the many side effects, but two important side effect on the clopazine. On the clozapine, sorry, on the clozapine. So the two are one is siloria. Okay, one is siloria, one is the yes decreased WBC. Already we have seen this one, and one is the increased oral secretion. Means the increased oral excessive increase in the oral secretion. We can say this one is the siloria. Okay, so the oral secretion are increased. There is excessive secretion which is coming out of the mouth. When the patient he will sleep on bed, okay, he will keep the pillow here, and on the pillow he will keep the face. Okay, so from the mouth continuously secretion is coming means the secretion will comes on the pillow and pillow become wet here. So the clozapine is having the side effect of the yes pillow wetting syndrome or wet pillow syndrome, which will be seen along with the side effect of the clozapine. So this is also important. And clozapine, which decreases the WBC, and decreased WBC increases the risk of the infection. So in order to prevent this one, we have to give the filgrastim. We have discussed already in the last video. Okay, so this is two important side effect on the clozapine. You people have to remember and give the best shot in the exam, right? So here is the one more and important question, that is the which of the following symptom is most commonly associated with hypertensive crisis, okay, caused by the MAO inhibitors. What is the MAO inhibitors? That is the monoamino oxidase inhibitors. What these MAO inhibitors will do? Consider this one is the one neuron end and another one, this one is the another neuron end. Okay, so yes, this is the one neuron end and this one is the another neuron end. So here our neurotransmitters will releases from the vesicles. Okay, consider here the serotonin or the 5-HT it came and noradrenaline it came here. So here is the one enzyme, that is what we call as the monoamino oxidase enzyme. So this enzyme it will destroys the serotonin and it will destroy the noradrenaline. Where we are giving the MAO inhibitors, that is the monoamino oxidase inhibitors, means this this MAO action, that is the monoamino oxidase action, it will get stops. Means the 5-HT and noradrenaline it will not get destroyed. Okay, so means the serotonin it will get increases and noradrenaline it will get increases. The serotonin increasing and the noradrenaline increasing means the mood also increases. So we can use the MAO inhibitors in the treatment of the depression. Okay, as a mood elevating drugs. Okay, so MAO drugs which are using in the treatment of the depression as a mood elevating drugs. Okay, so if in case along with the MAO inhibitors by mistakenly tyramine rich drugs, if the patient had, okay, so if the patient had the tyramine rich drugs means this is also like exogenous noradrenaline, okay, and this is also like exogenous serotonin. So already with the MAO inhibitors, the serotonin is increasing and noradrenaline is increasing. So if the patient has tyramine drugs, again the serotonin and noradrenaline excessively increases. So excessively increasing means it will cause us the dangerous hypertension. That is what we call as the hypertensive crisis. Okay. So when the hypertensive crisis happens, if the patient had the MAO inhibitors and the tyramine rich drugs like cheese, and like cheese, red wine, red meat, and especially the chocolates and all, which all are having the tyramine rich. Okay, so if the patient had the tyramine rich and MAO inhibitors together, there is chance of the hypertensive crisis. So which of the following symptom which is telling that the patient is experiencing the hypertensive crisis? बच्चों noradrenaline is increasing, I am telling here. So the noradrenaline increasing means the heart rate will increases. The heart rate is increasing means there is tachycardia, not bradycardia. I am eliminating the option A here. So then option C is the hypotension. What I told, the noradrenaline is increasing means the sympathetic activity will increases, means the blood pressure also increases, means hypertension will happens, not hypotension. I am eliminating the option C also here. So then the drowsiness will not happens. There is excessive alertness, okay, and there is inability to sleep. That is the insomnia can have experience, okay. Insomnia may experienced by the patient. There is no drowsiness. So I am eliminating the option C. If the patient is having the severe and dangerous headache, severe and dangerous hypertension, the most common complaints in the hypertensive patient is the headache, and there is severe hypertensive crisis means the patient will experience the severe headache along with the MAO inhibitors, which indicates the hypertensive crisis. So the most common symptom, which is mostly associated with hypertensive crisis, is the severe headache. This is the most important question, and it will repeatedly strikes in your exam. So again, I will come with the screenshot of these questions only. Bacha, I have already told the concept to you. Okay, this is striked in the exam. Whether if people wants to revise or not, it is up to you. Okay, if you want to great ranks in the exams, revise the great things and revise the great concept. Okay, so hope the concept is clear on the MAO inhibitors, tyramine rich food, and severe headache. Okay, yes, is that clear? And one more important questions, that is on the, yes, serotonin syndrome. Very importantly, your market question. It may strikes in your upcoming other exams also. Okay, so which of the following is a drug? Okay, sorry, which combination of the drug can increase the risk of the serotonin syndrome? Yes, option A, that is the selective serotonin reuptake inhibitors, SSRI. So these are the also antidepressants drugs and tricyclic antidepressants. So TCS are the tricyclic antidepressants. So if we are giving this together, these both drugs together, it may leads to the serotonin syndrome. I will come to this point. Okay, so why and how it will cause the serotonin syndrome? Bacha, so just a minute back, I have to explain the thing that is on the serotonin and how it improves the serotonin. Okay, so consider this is the one nerve ending, and this one is the another nerve ending. Okay, yes. So here from the vesicles, I told the neurotransmitters will come and it will act on the this postsynaptic membrane. Okay, consider this one is the 5-HT, that is the serotonin. Okay, and noradrenaline along with this one. Okay, so it is coming and acting on the receptors, and the receptors will stimulate and the normal mode will regulate. Okay, if in case there is deficiency of the serotonin, just a second please, I will come back in a second. Yes. So what I am telling here, this is the one nerve end, and this one is the another nerve end. So this one is the presynaptic membrane, this one is the postsynaptic membrane. From the vesicles, from the presynaptic membranes, the neurotransmitters will releases. Okay, it will act on the receptors. So that is the serotonin and noradrenaline. If normal serotonin is there, normally it will act on this one. Okay, normal mode will regulate. So in depression, what happens? The serotonin amount will get decreases. Okay, so the serotonin or the 5-HT amount it will get decreases. So in order to treat that one, so we are giving here selective serotonin reuptake inhibitors. What it is telling? It is selectively holding the serotonin and it is preventing the reuptake. What is the reuptake? The serotonin is coming here and it is reabsorbing by this one. So this is what we call as the reuptake. So here we are inhibiting the reuptake means so we are inhibiting the backflow of the serotonin here. So backflow of the serotonin is inhibited means the amount of the serotonin increases here, right? So the amount of the serotonin increases means we are here the in depression the serotonin is decreased, that is what the low mood will be there. So SSRIs are increasing the serotonin and it brings the normal mood. Okay, so this is how the actual drugs works, that is the SSRIs. So, along with this SSRIs, we are giving the tricyclic antidepressants. So, this tricyclic antidepressant also it will increase the serotonin. Okay, so also it will increase the serotonin. So, already because of the SSRI, serotonin is increased, and tricyclic antidepressants also increasing the serotonin, means it is over increasing the serotonin. Because of the over increase in the serotonin, there are the group of the sign symptoms comes like this. Okay, so what are the group of the sign symptoms? Okay, remember EORS, that is the ORS, means there is very much dangerous opisthotonus. R is the yes, yes, and E, there is eye changes, means eyes will go upward. Sometime oculogaric crisis we can also see. Then opisthotonus it will be seen. Then there is rigidity. Then seizure will come. These are the classical features of the These are the classical picture of the our serotonin syndrome. Bachcho, remember eye changes, opisthotonus, rigidity, and seizure because of the tricyclic antidepressants plus SSRI. If you are giving together, so these symptoms happening means we call this one as in the serotonin syndrome. This is very important. All the people have to know and give the best shot in the exams. So this is the reason in all book. Okay, so they have written in the note that don't give TCAs, tricyclic antidepressants with other antidepressants. Never ever give the tricyclic antidepressants with other antidepressants because it is double increasing the serotonin, and double increasing the serotonin means leads to the coming of the group of the sign symptoms. That is the yes, because of the increased serotonin, group of the sign symptoms is coming. That's the serotonin syndrome we can say. So this will be happens, and the correct answer for this question will be the SSRI and tricyclic antidepressants we are giving together means it will increases the risk of the serotonin syndrome. It may strike in your exams, and clinical features of the serotonin syndrome I have told, that is the yes EORS, right? Hope the concept is clear on this one. And here is the next question. So which of the following is not a common side effect of the phenytoin? Okay, very important. Last time the question they have asked on the fetal hydantoin syndrome, right? In the last narset, the questions asked on the fetal hydantoin syndrome is the teratogenic effect of which drug? That is the phenytoin. Bacho, remember I am telling, don't miss any antidotes. Read all antidotes before going to the exam and read all teratogenic effects. Read all teratogenic effect and read all antidotes before going to the exam. Okay, if you want separately a video on the antidotes and the teratogenic effect, so do comment in the comment box. That is, we want antidote, we want teratogenic drugs. Like you do mention in the comment box, so I will make a video on that. If there is more than 15 comments, it will come. So okay, so yes, the question is simple. Which of the following is not a common side effect of the phenytoin? So phenytoin long effect means chronicle if the patient is taking means it will deteriorate the bone and it makes the bone the soft. The osteomalacia is the classical chronic side effect of the phenytoin. So it is phenytoin side effect. So we want which one is not a side effect. So then option B, that is the gingival hyperplasia. This is the earliest earliest side effect of the phenytoin is the gingival hyperplasia. Then hyperglycemia, yes, it happens. There is chance of the hyperglycemia and there is chance of hypoglycemia also. Okay, so primarily it causes the hyperglycemia, right? So then again, here that is the yes, why it causes the hyperglycemia means it decreases the insulin sometimes. Okay, so option D is telling that is the hair loss. Nahi bachcho, there is no hair loss, there is excessive hair growth will be there. So that is what we call as the hirsutism. Okay, what we call that one is the hirsutism. Hirsutism is the yes, the male like hair growth will be there in the females. That is what we call as the hirsutism. Bacho, in yesterday's section we have discussed on the ATT drug. While discussing the ATT drug, that is on the side effect of the isoniazid, I have told the gynecomastia. What happening in the gynecomastia? In the males, female like breast development will be there. That is what we call the gynecomastia side effect of the isoniazid. Okay, so again here in this session I am telling the side effect of the phenytoin, that is the hirsutism. What the hirsutism? The male like beard, mustaches, it will come from the females. So that is what we call as the, yes, hirsutism. So, as a side effect of the phenytoin, so patient will experience the hirsutism, not the hair loss. Okay. So, remember with the mnemonic, here the phenytoin P stands here as the peripheral neuropathy, and very importantly, purple glove syndrome. So, what is the purple glove syndrome? And it is associated with the, yes, the purple glove syndrome is associated with the phenytoin. So, like this. Okay. Remember this image based question also. Okay, so this is the image based question. This is the purple glove syndrome. What happens if you are inserted the IV cannula? Okay, so if it is extravasated, means the cannula is get out of the veins, and whatever the phenytoin you have administered, it is extravasated here in the subcutaneous tissue, means it will get converts this hand to the purple. Okay, so your cannula site will be here, and this is the part. Till this one we used to wear the gloves. Okay, so this particular part it becomes the purple in color. So this one we can say that is the purple gloves syndrome. Okay, so it is associated with the phenytoin extravasation. How it happens? It happens if the phenytoin is leaked in the subcutaneous tissue. So that is purple glove syndrome, which is associated with the phenytoin. P here stands as the peripheral neuropathy. Then purple glove syndrome, the most important point. Okay, H here is the hirsutism, that is the excessive hair growth in the female like male. Okay, that is the hirsutism. Then E here is the enlarged gums or the gingival hyperplasia, the earliest side effect of the our what we can say phenytoin, that is the gingival hyperplasia. E here is the enlarged gums and gingival hyperplasia. N may causes the nystagmus, means the eye will abnormally continuously keeps on moving. So that is what we call the nystagmus. Okay, there is yellowish changes in the color of the skin. Okay, because of the vitamin D deficiency, and vitamin D deficiency which leads to the osteomalacia also. Okay, yes, is that clear? And T is the toxicity. Toxicity may causes the ataxia and tremors. Okay, very dangerous. The severe side effect, the severe and dangerous side effect are the ataxia and tremors. Okay, which indicating the phenytoin is overloaded. Okay, so then there is increased liver enzyme because of the liver damage and neurogenic changes also which happens. So mainly all people have to remember is that these 3 points, that is the purple glove syndrome, hirsutism, osteomalacia. Okay, and enlarged gum, or we can say gingival hyperplasia, and there is bleeding from the gum also, it will be there. Okay, there is bleeding from the gum also, it will be there. Okay, so patient with who is having the phenytoin, he will never experience the hair loss, because there is hirsutism, means abnormally excessively hair extra growth will happens in the patient who is having the phenytoin. Okay, so these are the all of the important questions we have discussed in the today's session. Okay, bacho, every question, every concept, every logic I have applied here is very much helpful for you all. So if you are really an aspirant who is preparing for the CRE exams, so make a note of this one, or else keep it in the 2x speed and watch it again. The definitely 2 to 3 questions will strike in your upcoming exams. I am assuring you. Okay, and one more point on the phenytoin, which is came in our last mark sheet. There is the, if the pregnant woman who takes the phenytoin, means her baby will experience the fetal hydantoin syndrome. So we will discuss on that one also in the next upcoming classes. Okay, so whatever the pharmacology I have explained you in last 4 classes are the most important pharmacology. Okay, it will strikes in your NORCET 8 exams, it will strikes in your RRB exams, it will strikes your KA exams, and it will strikes your upcoming CRA exams. Okay, so who all are preparing for KA also make a note of it and write it, revise it, because these mnemonics will be a golden mnemonics which decides your ranks in the exams. Okay, so hope the concept and whatever the things I have explained here today is the very easy and understandable for you all. So if you have any doubts, you can comment in the comment box, and if you have the overwhelmed love towards the MNC class, yes, just mention your love in the comment box. I am waiting your feedbacks in the comment box. We'll meet again in the next class. Okay, and don't forget to practice the test series, okay, which is there live in our app. So that is the CRS same pattern test series, because very few days we have left for the exams. Okay, so that is the 100 questions. 75 is the nursing question, 25 is the non-nursing question, and with 5 sections. And if you have any doubts, the contact number is given here is the 8296554687. So this number you can contact and make a message and clarify your doubts and get practice with this one before going to the main exam, because it will help you all to take a calculated risk. And once after giving the exam, you people will get to know that so what, how many questions I am correcting here, how much mistakes I am making here, how many negative questions are coming here, so how much I have to control the negative marks. One clear calculated risk ratio will comes in front of you all. Based on that, you have to perform in your main exams, so that will give you a correct and proper rank in the main exams. So we will meet in the next session. So तब तक के लिए जय हिंद, जय भारत. Stay connected, stay motivated, and keep studying, keep working hard, keep working smart, and get your good rank and come with a sweet to the MNC family. So we will meet in the next class. तब तक के लिए जय हिंद, जय भारत.